إله إلا الله لا إله إلا الله ما لنا رب سواه.
بسم الله الرحمن الرحيم. الحمد لله رب العالمين، والصلاة والسلام على رسوله الكريم وعلى آله وصحبه ومن تبعهم بإحسان إلى يوم الدين. السلام عليكم ورحمة الله وبركاته. Dear brothers and sisters and our community members, we greet you with peace, and we are with you again today, our Saturday halaqah, an update on COVID with our beloved Dr. Zubair Saeed. As you all know, he is a community health specialist, and he's from the Fairfax County Health Department. He has been helping us and has been conducting public health outreach seminars and updates, and he has been with us on a weekly basis now, thankfully. He is going to talk with us again today about the most recent update on COVID, and at the end of his talk, inshallah, we will address your questions. We like you to send your questions to the following. We are broadcasting on Facebook with ECNA Virginia Masjid, ICNAVA Masjid, and also on YouTube the same way, ECNA Virginia Masjid, and on the website, our website, icnavirginia.org, icnava.org /TB. Again, Dr. Zubair, welcome to our program, and we are very grateful that you're with us on this evening as well. So we'll leave the microphone for you, and you give us the update. Go ahead. Thank you.
All right. Assalamu alaikum wa rahmatullahi wa barakatuh. So we always begin with the number of cases in Fairfax County. So the tally now is up to 1,636 confirmed cases of COVID in Fairfax County, with unfortunately 43 deaths due to COVID-19 in Fairfax County. That's up to date as of today. So we see that every week we're seeing more, a great number of cases every week. So again, this is just another reminder that even though we may be seeing flattening of the curve in other places, maybe we see a plateau of hospitalizations or deaths in other places, certainly what we see here in our local area in Fairfax County is the opposite. We're seeing an increase. We're on the rise, number of cases and deaths each week. So keep that in mind, that we are seeing active community transmission in Fairfax County. Let's go over some things, some new information from this past week. So you remember I mentioned loss of taste and smell as a possible sign and symptom of COVID-19. It's been talked about for several weeks now. Well, yesterday, the Centers for Disease Control, the CDC, they officially recognized loss of taste or smell to be an official symptom now of COVID-19. Now, what's interesting about this symptom is that for some people, they will not be able to regain their sense of taste or smell for weeks. It might take them weeks before they get it back. For other people, it might be days. And other people who get COVID-19, they will never experience this symptom. So this is, again, a reminder to us that this is a disease which the clinical presentation is variable. Not everyone experiences the same signs and symptoms. Fever, cough, and shortness of breath, of course, are the main symptoms. But again, not everyone shows those signs and symptoms, and not everyone is going to get loss of taste and smell, or body aches, or chills, or what have you. But some people will experience some symptoms, and others will not. And of course, many people will not experience any signs or symptoms. So let's just keep that in mind, that if you're not feeling well for whatever reason, you notice something odd about yourself, something different, call your healthcare provider and get yourself evaluated. We've been talking also for weeks about the groups of people at higher risk for severe illness due to COVID-19. And of course, one of those groups of people includes people who have underlying health conditions. And up until this point, we've been telling people, what are these underlying health conditions? We've been saying people who have heart disease, lung disease, diabetes, cancer, some sort of immunodeficiency, obesity. Obesity is another one we've mentioned. So all of these people are what we consider underlying health conditions that leave them more at risk for being hospitalized or dying because of COVID-19. But we should also mention two other conditions. So if you have chronic kidney disease that requires dialysis, or you have chronic liver disease, it's also advised that you take extra precautions because you also are at higher risk of illness due to COVID-19, severe illness and hospitalization and death. What we see with dialysis patients is that they are more prone to infection and severe illness because of weakened immune systems, treatment and procedures to manage kidney failure, and they may also have coexisting conditions such as diabetes. Severe illness caused by COVID-19 and medications used to treat some severe consequences of COVID-19 can cause strain on the liver, particularly for those with underlying liver problems. People living with serious liver disease can have a weakened immune system, and that, of course, leaves the body less able to fight off COVID-19. Another thing that we wanted to mention this week is that this is very interesting information, but I want to caution people that what I'm about to share with you is it's a very preliminary research. More research is being done about this topic, but it's kind of alarming, I would say. So some research has now shown that this coronavirus could be infecting T cells in the body, and T cells are cells that are involved in the immune response. They're part of the immune system. They fight off infection for us. And if you recall, or if you know about other viruses like HIV, the virus which causes AIDS, human immunodeficiency virus, HIV, that also infects T cells in the body, and it results in T cells dying off. And because of that, the body is less able to fight off infection, and then the body gets infected with all sorts of other infections. That's what we see with HIV/AIDS. Well, now some preliminary research is showing that this novel coronavirus could possibly be also infecting T cells and killing them, which of course leaves the body less able to fight off coronavirus and other infections. And it's possible as well that this novel coronavirus is not only infecting T cells and killing them, but it's also hijacking these T cells and turning the T cells against our own bodies to attack our body. So again, I want to caution everyone that this is still very early on in the research, but there was a study that shows that this is happening and can happen. So we'll definitely be following that more closely to see if there's more information on that. Other news information out this week, and it's not so new, but it was talked about quite a bit, is that we now know that prior to showing symptoms, so someone gets the virus, they get infected with the COVID-19 virus, and before they show symptoms, about 1 to 3 days before they start showing symptoms, we now believe that that person is highly contagious. They're actually most infectious during that period of time. People might think or might assume that when someone is coughing or sneezing or showing symptoms, that they are most infectious at that time. Well, apparently that's not true. So now researchers, scientists, they believe that a person is most infectious with COVID-19 1 to 3 days before they start showing symptoms. We're also seeing, of course, very poor outcomes in diabetic patients with COVID-19. And we know that in diabetics, that their immune system doesn't work as well, and that diabetic patients suffer from poor circulation because their blood vessels get damaged due to the high glucose, high sugar in their blood. And this kind of brings up another point, which is how coronavirus is affecting blood vessels in the body. So you recall from previous week updates, from previous weeks, we talked about how the virus, this coronavirus, infects our body. that the protein spikes on the virus attach to ACE receptors on different cells in our body. Of course, there are ACE receptors in the lungs, but we said that ACE receptors are not only in the lungs, but they also are located on other organs in the body, like the kidneys, the liver, small intestine, the brain. But we also know that ACE receptors are found in other places in the body, such as the heart, even the eyes and the nose. And this could be why coronavirus has such wide ranging effects on the body, because this is how the virus gets inside of our cells, namely through these ACE receptors. And these ACE receptors are not just in the lungs, but in other places in our body. So some we have seen in some COVID patients that they experience conjunctivitis, which is inflammation of the membrane that lines the front of the eye and the inner eyelid. And it's thought that this symptom of conjunctivitis, pink eye, if you will, is more common in the sickest patients. Um, the virus, also has found to perhaps be entering cells that line the blood vessels in our body. Remember, the blood vessels are tubes in our body that transport blood all along our body. And we're finding out that in some patients with severe illness due to COVID-19, they're in the hospital, maybe they die because of COVID-19. We're finding blood clots in the blood vessels of such deceased patients due to from COVID-19. And of course, ACE receptors are also in the lining of our blood vessels. And so it's possible perhaps that this virus is also infecting the lining of our blood vessels. And it could be that coronavirus infection is promoting blood clot formation and heart attacks, and even causing inflammation of the heart. So all signs pointing to that this is a very serious disease, and a disease which has wide-ranging effects on our body. You may have heard a lot of talk of antibody tests. Of course, we've been talking about that in our updates as well in previous weeks. Remember, if you recall, antibodies are proteins that the body produces in response to an infection, like coronavirus, for instance. And these antibodies allow the body to fight off a future infection. If the body gets reinfected with the same type of virus, then the body can recognize it and fight it off. However, as we've said before, just because someone recovers from coronavirus, it is not yet known for certain if that person will be immune from future infection. And we also found out this week that it's not everyone who recovers from coronavirus produces these antibodies. So the natural point here is that the natural conclusion is that maybe perhaps not everyone who gets coronavirus and recovers from it is necessarily immune, because maybe they don't produce the antibodies. It was in a small group of people, but nonetheless, it's a number of people that don't produce antibodies to coronavirus infection. And again, even if they do produce the antibodies, does that mean necessarily that they will be immune from future infection? Again, we don't know for certain. The FDA, in its effort to kind of get as many tests out there as possible very quickly, they've kind of relaxed the regulations on antibody testing. And so when anytime you relax the regulations on things, it enables tests to get out there faster, but it also affects the quality. So some antibody tests may suffer from qualitative defects, and it may not be so accurate. The CDC has developed their own antibody test already, and they're going to use it to assess the number of infections of COVID-19 in the United States. And they're not going to test everyone, of course, but they're going to use this antibody test as a way to get a better estimate of exactly how widespread this infection is across the United States, how many people, to get a better idea of exactly how many people have been infected in the United States. A question that sometimes people ask is pertaining to gloves. People say, should I wear gloves in my regular routine every day? Is it effective to wear gloves? I would say that gloves can tear. First of all, okay, even like doctors and clinics and hospitals, they take off gloves. They can tear even in regular use. Also, you have to be very careful in how you take off the gloves. And if you don't do it properly, you can easily contaminate your hands. And wearing gloves gives people a false sense of security that they're somehow very well protected against coronavirus. So my general advice is, again, hand washing with soap and water, 20 seconds. It's better for you than wearing gloves. So that's my general advice about that. How about BCG vaccine? Maybe, I don't know if people have heard about it, but it has been theorized that perhaps BCG vaccine helps protect against coronavirus. BCG vaccine is a vaccine that's administered to many people in other parts of the world, but not in the United States. They don't use BCG vaccine. BCG vaccine is used to help prevent tuberculosis, which is a disease that's not caused by a virus. It's a different type of germ. It's a mycobacteria, and it's a different disease and causative agent altogether. But it's theorized that perhaps BCG vaccine somehow stimulates the immune system in such a way that it stimulates the immune system to fight off more than just tuberculosis, that it may be somewhat effective in fighting off coronaviruses. Now, the reason this was theorized is because they have seen that in some other countries of the world, there aren't as many cases, there aren't as many deaths, and they're saying, oh, well, maybe in those countries that's happening because a lot of people in those countries get BCG vaccine, and therefore, voila, that's what that shows, that BCG vaccine is effective. But hold your horses. Of course, we that's not how science and medicine work. So they're going to be looking into this. They're going to be researching this. But right now, there's not enough evidence at all yet to show definitively that BCG vaccine helps to prevent coronavirus infection. So there's no approved medication as of yet. There's no vaccine available as of yet that prevents coronavirus. Um, let's see. Oh, one interesting thing I wanted to mention, and I think this is my last point for today's update, which is that for several weeks, if not months now, we've been seeing that men are dying at a greater rate compared to women due to COVID-19. And at first, it was theorized that maybe this is because men smoke more often in other parts of the world. They smoke more frequently than women, or women don't smoke as much in these other countries, and therefore that's why men are more likely to die from COVID-19. And then it's maybe it was thought maybe it's linked to behavior, because men are less likely to wash their hands than women. Maybe they're not as careful about it, so they get infected more. But what I can, and I don't, any of these theories, we don't know for sure. These are just theories right now. But what I can tell you is that in general, we do know that women do have a stronger immune response than men. And this is both a good thing. This is both a blessing and a curse in a way, because yes, it's good to have a stronger immune system, because then you're able to better fight off infections. However, we also know that the immune system can be our best friend and it can be our worst enemy. It can turn on us and attack us instead of fighting off infections. And when the immune system turns on the body, these diseases are called autoimmune diseases, in which the immune system, instead of doing its job in fighting off infections, it attacks the body. And autoimmune diseases are more prevalent in women than compared to men. So that's why I say that having a stronger immune system is both a blessing and can also, unfortunately, be a curse. But we do know that the immune system, for reasons that are not entirely clear, are that immune response is stronger in women. One reason possibly could be that we know that estrogen increases the antiviral response in particular. So in other words, the hormone estrogen, which is the primary female hormone, which also exists in men, but in different forms and to a much smaller amount, a much lesser degree. Estrogen is the primary female hormone, and it's found that it helps to boost the antiviral response. And we know that many genes that regulate the immune system happen to be located on the X chromosome. And we know that men have only one X chromosome, whereas women have two X chromosomes. So um, these are just kind of some theories that lend credence to the fact that women have a stronger immune system than men, and perhaps it's a reason why they are less likely compared to men to die from COVID-19. Although, of course, many women have died from COVID-19 as well, but comparatively, the rates are more favorable to women than men. So as I always do every week when I close these updates, is to just again remind everyone that again continue to stay at home. That's the guidance. Stay at home as much as possible. Wash your hands, soap and water, 20 seconds. Cover your coughs and sneezes the right way. Covering your cough and sneeze with your sleeve, or using a tissue. Throw away the tissue, then wash your hands. Avoid touching your eyes, nose, and mouth. Make sure that if you have symptoms of COVID-19 that you're in isolation, separating yourselves from everyone, and make sure that if you are in contact or exposed to someone who has COVID-19 that you separate yourself, and of course that's called quarantine. Okay, so I think those are all the updates I have for this week. So at this point, I'm happy to answer any questions if anyone has any questions.
Well, Jazakallah khair, Dr. Zubair. And thank you so much for this update. We have a few questions. Now, I just want to catch up on what you said last. If somebody got exposed to someone with COVID-19, should quarantine themselves for 2 weeks. Now, after they go through this period and they have no symptoms at all and they're doing fine, should they get tested, or should they, what happened right after 14 days? They just come out, and do they have to do anything?
No, typically they're not going to be tested. If they're after 14 days, if they don't show any signs or symptoms, they're presumed not to be at great risk of infection, nor are they presumed to be a risk at infecting others. And at that point, it's not, the general guidance is, the guidelines are that they're not to be tested. Is it possible that someone after the 14 days can show signs and symptoms? I'm going to say that that's possible, but very unlikely, but it's possible. We're always learning new things about this virus, and there's always outliers. But I will say in general, if you pass through a 2-week period in quarantine, not showing signs and symptoms, it's unlikely that you will pose any risk or infection.
Now, I have a couple of questions. What are some best practice recommendations during Ramadan? As we know we're coming into Ramadan, people have a concern with the fasting affect that. What should we do since we are, inshallah, may Allah make us reach Ramadan, all of us. What should we do? Any advice?
Because in Ramadan, when we're fasting, and there is research to show that fasting has beneficial effects on the body, but especially in the first week, our bodies can become run down and weak because we're not used to it. And the first week is usually the most difficult week, and then after that, the body adjusts. And so what I would say is, first of all, keep yourself well hydrated. Make sure you get up for suhoor. Drink a lot of water. At iftar time, drink a lot of water. Hydration is very important in general, and it's, I think, especially important during this pandemic. It is actually the advice of people in public health and clinicians, doctors, that if you do have symptoms of COVID-19, they say stay at home, rest, and get plenty of water. So in general, I would say make sure that you're well hydrated. I would also pay particular attention to what you're eating. I know in Ramadan, Ramadan, of course, is supposed to be a time and we're supposed to be abstaining from food, but people sometimes actually gain weight in Ramadan because they eat too much at iftar. So I would say pay particular attention to the food you're eating. Eat more fruits and vegetables. You need to get the essential nutrients your body needs. I don't think it's a bad idea to take multivitamins. Of course, you can talk to your doctor more about how much vitamins you should be getting, but in general, I would say follow the RDA, the recommended daily allowance of vitamins, and get enough vitamin C, get enough vitamin D. these vitamins help the immune system to function and to keep up and running. So if you're getting a good amount of vitamin C, good amount of vitamin D, the proper amount, then you're keeping yourself healthy in general, anyways. Um, and that, yeah, and I used to do presentations. I did it at the Ikna Masjid about foods that the Prophet ﷺ ate. So I always advise people, Ramadan's a good time to start getting in the habit of that. Of course, we already do that in a way because we eat dates, which is something that the Prophet ﷺ ate quite often and is very healthy for us. But there are other foods that he ate too, like mushrooms and grapes and cucumbers and lentils and barley. And so I would, and there's a whole list of foods that the Prophet ﷺ was known to have eaten and liked to eat. And so I always advise people, especially during Ramadan, to get in the practice of eating those foods.
Jazakallah khair. We have a question saying that people, when they have underlying illness, they get hospitalized, they get sicker. And he's asking, or I'm not sure the name of the, whether if male or female, but anyway, the question is, there are people that do not have an underlying conditions that are being hospitalized. What would be the reason for that?
The short answer is we wouldn't know. But what I will tell you is that the overwhelming majority, and I believe it's around 90% of hospitalized cases of COVID-19 in the United States, people have at least one underlying condition. That's 90%. So yes, of course, there might be 10% of people who don't have an underlying health condition. And we just don't have enough information at this point to say what is causing severe illness in those people. But what I will tell you in the United States, what's the number one most common underlying condition in hospitalized COVID-19 patients? The answer is high blood pressure. Number two is obesity. And obesity we are particularly seeing in individuals who are younger than 60 in the United States who are hospitalized due to COVID-19. They are obese. So again, a reminder for people, especially in Ramadan, be careful of how much food you're eating and control your weight.
Understood. Does anything change in terms of best practice when the peak hits in our area? Should we still go out for essentials? Should we lock ourselves in completely?
The health department will definitely come out with additional guidance if it's needed, if we see even more spread of disease. But I don't imagine that the guidance will really change all that much. I think that the lockdown in Virginia is till June 10th. My feeling is that will not be lifted before June 10th. The governor always has authority to do so. But even as cases increase in Fairfax County and deaths increase, I don't think that they will be telling people necessarily that you can't go to get essentials from the grocery store or perform other essential functions. But definitely, I would say that they're going to be a lot more particular about asking people who are out and about what they're doing. That could be a possibility. But and again, everything I'm telling you could change. Things. What we've seen in this pandemic is things change all the time. But my thinking is, until June 10th, whatever we're seeing now is probably the way things are going to remain, at least until June 10th.
So do you anticipate any, like we have over 1,000 in Fairfax, what is your, like in the health department, what they're anticipating it's going to be the peak, like the epi, time and numbers?
Yeah, I think that, of course, this varies from state to state, and I know you're asking for Fairfax County, but I will tell you that like any idea of models predicting a peak in Fairfax County are not really being revealed to the public. It could be that they're not revealing it to the public either because they don't have that information or they're not sure entirely, because that type of information as so far is from a state level. So the state of Virginia may anticipate a peak hitting sometime in May, but I couldn't tell you for sure, like to narrow it down to Fairfax County when the peak is going to be, particularly in Fairfax County, because in Fairfax County, they're not even they're not breaking it down by district. Like I can't tell you what the rate of infection is in Alexandria compared to Herndon, compared to Reston or whatever. They're not revealing that data. And they're also not revealing data by ethnicity within Fairfax County. So this type of information, is more available at the state level. So unfortunately, I don't have a good answer to tell you about when the peak is really going to hit in Fairfax County. I just don't have that information.
I'm looking at the COVID-19 on the Virginia website, Virginia Gov, and I see number of people tested, almost 52,000. Total cases in Virginia, 8,000. Total hospitalization, about 1,300. Total death, 258. If I ask you, Dr. Zubair, to your knowledge, what would be the hot spots? In the past, I used to look and follow it closely, but I haven't done over the last few days. So I know Fairfax is, Arlington is. Any other hot spots in the Northern Virginia area?
I would say all of Northern Virginia, out of the state of Virginia. I don't know if necessarily Northern Virginia is being classified as a hotspot, because when we think of hotspots, we think of New York, we think of Washington State, California. I don't think as of yet you would classify Northern Virginia area in that category. But compared regionally, compared to the rest of the state, yeah, we're getting a lot more cases in this area than other parts of the state.
Interesting. The real question is, when are we going to end with this?
Yeah.
I wish we know the answer. I know different state and all this, but as a physician, do we have, I know they're talked about models, federal or nationwide, like a few days ago, who's going to plateau and all this. But if we take like overall US model, when do you think the peak would be and the end would be? 2 months, 3 months, 4 months, 5 months?
Yeah, well, they're looking at, they're looking at the peak hitting like in May and June, July, perhaps. But I want to be extremely cautious about making predictions like that, because we really, none of us really knows exactly. Sure. Yeah, and but it kind of looks that way, and it kind of also looks like the curve has been flattened because everyone is staying at home, which is a good thing. But this can, if restrictions are lifted too soon, very easily we can see the cases go up. And I want to remind people that this is actually a more serious situation in the United States compared to other countries. And I'll tell you why. And I think everyone possibly knows the answer to that. Because it has to do with the underlying conditions. Where a lot of people in the United States, over 50% of Americans have at least one chronic condition. High blood pressure is very common. Obesity is much more prevalent in the United States compared to other countries. And I told you, and I don't need to go into it again in detail, we talked about why obese people are more at risk for this. It has to do with the inflammation in the body that their fat cells cause. So this is the reason. This is the reason, because so many people in America, unfortunately, have these underlying health conditions that we need to keep these measures in place. Now, I will tell you, I'll be a little bit open with you and say that there has been some debate, and I would say somewhat healthy debate within the public health sphere about is the way that we're handling this at a national level really the best way to go about this? Like, some people question, like, well, if younger people are not that at risk, if they don't have an underlying condition, why can't they just go out and everyone else stay at home? And at least we have some semblance of an economy. Or and there are different approaches. In Sweden, they have restrictions, but they don't have a complete lockdown. Or and then there are other countries like Germany, which have a low number of cases and low number of deaths. And then there are places like Ireland and England, where England has many, many more cases and deaths than Ireland, and Ireland is right there, but they have far fewer. They have a fraction of the number of cases and deaths. So there are different ways of approaching this pandemic, and some of it has to do with the demographics. If you have more people in your society that are older, like in Italy or in the United States, where people have a lot of underlying health conditions, we have no choice but to take these measures, to have this lockdown, to have these restrictions in place. Because if we don't, I can almost guarantee you that we would have so many more numbers of deaths, because this is a very contagious disease. So again, to answer your question about when this is going to end, my feeling is, if people are asking that question in a sense to say, when are we going to go back to our life that we had a few months ago? I don't really see that happening for perhaps a year or more, because we're not going to have a vaccine for at least a year, year and a half, and that's if everything goes perfectly. And until that happens, we're in a situation where we have a very contagious disease. It can spread very easily to people, and there's no effective treatment. So, what is the alternative other than to accept that many people will die, perhaps hundreds of thousands? And that can also impact the economy. So, unless an effective treatment comes along before the vaccine gets developed, which is possible, that can happen. And if they come up with a great drug that effectively cures coronavirus, then we can possibly see a greater easing of restrictions. But what I would tell you for the time being, for the next few months and possibly a year, is that different states and regions may gradually open, but it will reopen in a phased way, as the Trump administration laid out: phase one, phase two, phase three. And gradual parts of society will reopen, but even when they do, there'll still be social distancing. People will still be wearing masks. You may go to a restaurant and your waiter or waitress is wearing a mask, and you may be required to have some type of menu that you pick up and then you throw away. So in other words, the life that we had a few months ago, I don't anticipate that coming back anytime soon this year, for sure. But that's my thinking on the matter. It doesn't mean that that's what's going to play out, but I would say that that's what most public health experts are also predicting, that we're not going to really see a return to the life that we had a few months ago, until next year. And evidence of that is no sports activities. They're not planning to have any sports the rest of this year. So that's never really happened before.
I tell you, it's really scary. I'm just looking at numbers now. We have 738,000 cases in the United States, and we could never imagine the number 39,000 deaths. It's just an astronomical number, and it's keep rising. The good thing about New York today was less than 600, which is a good sign in a way, even though it's still a large number and terrible to see that, but hopefully that will, going with the curve further down. I don't have any more questions, Dr. Zubair. I do want to thank you so much on behalf of our community and all the communities that, been following you closely and following your updates. And we pray to Allah subhanahu wa ta'ala to give all our community good health and make us reach Ramadan, and ask him to forgive us and accept our repentance, and may Allah subhanahu wa ta'ala accept all our good deeds. I do want to remind our listeners here that inshallah we will continue on meeting once a week, or maybe on Saturday, with Dr. Zubair. The time might change a little bit, but we'll keep you posted. And we wanted you to keep following us, inshallah, on the Facebook, and that is Elah Virginia Masjid, and also on YouTube the same, and on our website www.eknavirginia.org. I wanted to remind our audience also that we have many programs lined up for you. And just to give you the first program that is related to Ramadan is this Monday. It will be at 8:30, and it will be Ramadan in quarantine. That's the topic. And we have 3 guest speakers: Sheikh Muhammad Hussein, and Sheikh Abdul Rahman Hussein, and Sheikh Hassan Muhammad. And that will be on Monday, April 20th. I'll take that back. It will be at 9 p.m. It will be at 9 p.m. inshallah. And as you all remember, we have programs throughout the week and on Friday. So we want you to keep following us. The last thing is I wanted to remind all of us, inshallah, that your masjid need your support. So don't forget to donate to your masjid. Remember, there's a lot of needy families that this masjid has been helping. And this is a very hard time that many of us going through. And we need to do our best to work together and help each other as much as we can, especially in those blessed days and blessed month. Dr. Zubair, thank you again for being with us. I appreciate your help all the times. And inshallah, we'll meet with you again next week. My brothers, I pray to Allah subhanahu wa ta'ala, pray to Allah subhanahu wa ta'ala to make us always gather on His obedience. ربنا تقبل منا إنك أنت السميع العليم وتب علينا إنك أنت التواب الرحيم وآخر دعوانا الحمد لله رب العالمين والصلاة والسلام على رسول الكريم وعلى آله وصحبه ومن تبعهم بإحسان إلى يوم الدين. السلام عليكم ورحمة الله وبركاته.